Behind all life-changing innovation is fundamental research. In applied health sciences, researchers are pushing the frontiers of knowledge, exploring the unknown, and challenging assumptions. They are giving researchers across disciplines the theory and science to solve pressing practical problems and improve lives.
Throughout our life, damaged structures build up in our cells. In healthy cells, we're able to remove and recycle these damaged structures through a process known as autophagy. If this process does not work properly, disease can develop. My name is Joe Quadrilatero, and I'm a researcher in the Department of Kinesiology. If we can understand how and why cells die, we can develop better strategies to keep our cells healthier. Ultimately, by keeping our cells healthier and preventing them from dying, we can potentially prevent and treat diseases, as well as slow down the aging process.
The relationship between a mother's nutrition during pregnancy and the health of her baby is well established, but the impact of her social experience is less well understood. My name is John Mielke, and I'm a researcher in the School of Public Health and Health Systems. I'm interested in how a person's social experiences become biologically embedded. In particular, experiences during the very earliest parts of life. I think in part, what's going to come out of our work is a deeper understanding, appreciation for maternal, newborn, and child health. A recognition that if we want to truly target to reduce adult levels of disease, we need to think decades before they actually appear.
Traditional approaches to qualitative inquiry tend to take a lot of messy data and try to sift it to reduce it to decontextualize codes, categories, or themes. This often doesn't show the complexity of the full picture. My name is Elizabeth Burberry, and I'm a researcher in the Department of Recreation and Leisure Studies. I'm approaching qualitative inquiry differently than traditionally done, where it takes the messy data and tries to make it into discrete categories, and instead using creative analytic practices and also arts-based methodologies. This is now a format that both typically is social justice oriented and also is accessible in a way that everyone can partake, learn, and try to change their realities.